What led you to do this research?
This research project is part of an ongoing effort to understand the relationship between a patient's humoral immunity and their outcomes when affected with a deep staph aureus musculoskeletal infection, such as those with a joint replacement or a fracture.
What unanticipated problems came up, and how did you deal with them?
This study was designed to collect data on 300 patients who experienced a deep staph aureus musculoskeletal infection. We recognized while doing the study, which was prospective, that collection of this enormous amount of data and the biological specimens was a heavy burden on the investigators. Therefore, we only ended up with 194 patients with the necessary data points, biologic specimens, and good one-year outcomes.
What findings surprised you?
We were surprised to find the significant association between high levels of protective antibodies against glucominidase, which is a staph aureus antigen, and improved outcomes after a deep musculoskeletal infection.
Should practitioners change their practice based on your findings? And if so, how?
Yes, I think that practitioners should recognize that although a deep staph aureus infection may represent a break in sterile technique during the surgery, it more than likely represents a lack of protective humoral immunity against the necessary staph aureus protective antigens that has developed since birth.
What remains the most important question unanswered by your study, and how do you hope to address this?
Well, we've only identified one protective antigen thus far in the study, so more protective antigens need to be identified as we continue to do the research. Additionally, as we learn more about protective antigens against staph aureus, we will ultimately be able to figure out appropriate passive and active immunization strategies that may help with treatment of these devastating infections.